The noon whistle in Fort Atkinson has just blown, which is the indication that I introduce myself. I'm Steve Larson with the Horge Dairyman staff up here in Fort Atkinson, Wisconsin, welcoming you all out there. If you are with us now, that means that you re-signed up, so to speak, for our webinar list, and we appreciate it. And as we said just a few minutes ago, if there are friends and colleagues, co-workers that wonder how come they haven't heard from Horge's webinar, they can go to the Horge website and click on webinars and sign up that way. Again, you can print out the PowerPoints that are going to be used today by going to the handout portion of your menu and following along with us. So, with with those comments behind us, I'm looking forward to hearing our presenter today talk about inflammation around a calving. What does it mean and how should we approach it? Well, we want to express our thanks to Virtus Nutrition, the makers of Prequel product, and we're glad to have you, Barry Bradford from Kansas State, with us. And for more of an introduction of Barry and to get us rolling this afternoon, Mike Hutchins down at the University of Illinois, our good friend and co-host. Mike, take it away.
Very good, Steve. Thanks much. And it's my honor and pleasure to introduce Dr. Barry Bradford as our presenter here today. Barry is a national and internationally recognized speaker on the area of inflammation and animal health as far as that goes. Barry grew up in southwest Iowa and on a cow-calf operation and got his bachelor's degree at Iowa State University, and then went on and got his PhD at Michigan State University, where he worked on metabolic regulation of feed intake in dairy cattle. 2006, Dr. Bradford joined the Kansas State University with a 40% teaching, 60% research appointment, and he's active in terms of not only that, but also teaching there at Kansas State as well. Recently, he returned from Australia, where he was on a 6-month sabbatic leave. So, Barry, that gives our listeners a bit of a quick overview of your background at this point, and we're very excited to have you here today with the title, as we see on the screen, Inflammation Around Calving. What does it mean, and how should we approach it? So, Dr. Bradford, we'll turn the program over to you.
Thanks very much, Mike, and Steve as well. Mike, I got to point out, since you were teasing me about Kansas State a minute ago, that Steve is, of course, one of our illustrious alums that we're very proud of. So I'm very much honored to be part of this webinar series that's got so many good topics, and hopefully the audience finds value in this one. So I'm going to try to cover a few things today. First of all, provide some background on the incidence of inflammation in early lactation dairy cows, and talk about, to the extent that we know, what causes that inflammation. Talk about why it matters for producers, because there are many long-lasting effects that have been at least associated with that. And then I'll spend probably half the time on some studies that have been done around altering inflammation and what that tells us about what's going on with that mechanism. So we'll take a break here and start with a poll just to kind of get a sense of what everyone's perception about this topic is before I really dive in. What do you see inflammation as?
Well, we have 5 choices there. So, Steve, you got to be voting here pretty quickly. We can either see it as a key problem in early lactation cows. Number 2, a common problem with no cure. Number 3, a minor nuisance, kind of like Kansas State. Not a problem. Number 4, and not really thought much about it. So, Steve, where are you going to vote?
I'll have to go from the personal standpoint. I just have not, I guess I focused on other fresh cow problems in the past and not really necessarily considered it an inflammation problem, so I might vote with the last one, that I haven't really given it as much thought as I think Barry will probably convince us today that I should have.
Yeah, and I guess
let's see what the others are saying.
Yeah, I think I'm going to vote there too, actually, to the truth, because, I guess I think sometimes inflammation is good and sometimes that's probably bad. Anyway, we've got 60% of the vote in. I think got a little hangover from the Trump vote here, so we're a little slower here today.
Everybody got tired of voting last week. So,
yep, so why don't we share that? And Barry, what do you think of the responses?
Honestly, I'm a little surprised. I thought more people would have said they hadn't really thought about it, so that, to me, is good. It sounds like people are at least seeing some information about the research that's going on. I'm guessing by the end of the talk, maybe there'll be a little bit of a more nuanced view. I personally think it's a key problem in early lactation cows, but I think in other cows it's probably a beneficial thing. So I'll kind of give you some background on why I think that's the case by the end. Okay. So as probably everyone in the audience knows, the transition period is a key time where we deal with probably the most prevalent health problems on a dairy farm. If you exclude the neonatal calves at least, transition cows account for, on most farms, over half of the total disease on the farm. And that's true especially for older cows, but also in first lactation cows. If we look at the total disease incidence per 100 cows on a given stage of lactation, you can see about 10% of cows in the first few days after calving are dealing with some kind of health problem, whereas when we get into the main part of lactation, it's more like 1 out of 1,000 cows. So this is a big time where if we can solve this problem, I guess, we can really improve the sustainability of our dairies, both from an economic standpoint and from a social license standpoint. One of the big frustrations, I guess, around this issue is it's not any one thing. It's not like we can go in and find some way to take out a single pathogen in this problem, because it's a big mix of different issues all kind of combined at the same time. So if I were to come up with a really rough rule of thumb about what makes up these conditions, maybe about 40% of these are pretty much essentially metabolic disorders, and about 60% might be infectious. But as you'll see in a moment, probably the majority of these are actually some kind of mixed condition where it's really both factors feeding together. So let me start off with a little bit of epidemiology. This is some relatively old data from Cornell, where they surveyed commercial farms and looked at incidence of multiple disorders in cows that had gone through the transition period. Now, let me set this up for a minute. So here they're looking at cows that had started lactation with metritis in early lactation, or with either acute or chronic mastitis in that short window of time. And what they're asking in this graph is, what is the risk that these cows have of getting another problem later? So the data here is shown as an odds ratio. And what an odds ratio tells us is, compared to the average cow in a herd, what is a subgroup of cows experiencing in terms of a risk? So the average cow in a herd has a risk of 1, or an odds ratio of 1, of getting, in this case, ketosis. But cows that have metritis in early lactation have nearly a 2.5-fold higher risk of getting ketosis than their herd mates. Likewise, if cows have either acute or chronic mastitis at that early lactation phase, they have from 1.5 to 2.5 times greater risk of ketosis. So again, the point is at the top of the slide here. Infections increase the risk of ketosis, and by default then total metabolic disease. But if we flip that same coin and kind of ask the opposite question and say, well, what if a cow gets ketosis first? What's her subsequent risk of getting an infectious disorder? Her risk of both metritis and mastitis go up significantly by 2.5 and 3.5-fold respectively. So again, just to try to make this as clear as possible, if average cow in a herd has, say, a 15% risk of getting metritis, cows that had ketosis early on would be 2.5 times that high, so nearly a 40% risk in that group. Okay, so really, if you look at both of those pieces of information, it's probably true that suppressed immune function allows an initial problem to develop in terms of either mastitis or metritis. Typically, maybe respiratory disease comes into play sometimes. And we don't really have great ideas right now on how to prevent that suppressed immune function, although there are some new tools that have come out recently. In turn, then, if a cow gets an infection early in lactation, the evidence suggests that that infection puts her at greater risk for metabolic disorders. And again, just from a very basic cow care standpoint, this makes some sense. The cow gets a bad infection, she's likely to stop eating or at least eat less. And of course, that's the biggest risk factor for metabolic disease. And finally, if a cow has metabolic problems, she's also at increased risk of infection. So we have these complex interlinks that really can drive some cows into a bad situation. And our question that my group and others have been working on for a few years now is, does inflammation provide a mechanistic link? Does it help to tie these problems together in a way that, again, drives disease processes that are difficult to stop? And I guess the bigger question is, if that's true, does it lead to new ideas about how we can maybe disrupt those pathological processes? So that means we need to step back for a minute and discuss exactly what inflammation is. So I'm going to introduce two different ways of looking at inflammation that are really fairly different. And I'm going to start with the inflammation term that most people are familiar with, which I'll refer to as acute inflammation. So this has been discussed for well over 2,000 years. The ancient Greek physicians would talk about inflammation, and they tied it to swelling, pain, fever, and all of those things are involved with the immune system's response to one of two things: either the presence of signs of infectious organisms or simply tissue damage. So you could have blunt force trauma that would actually cause these same responses. So what happens when the immune system senses one of these things is that there are a number of cell types that are resident in all the tissues in our body at varying degrees. But around your skin, there are a couple types of sentinel cells. They're kind of looking for problems all the time. And I'll start with macrophages because these are a very important component of what's called the innate immune system. So we typically break immunity into innate immune responses and humoral immune responses. The humoral side is the antibody production arm of the immune system that typically takes longer to respond, and the one that can develop a memory, so to speak. That's the one we target when we vaccinate. But the innate immune system is one that's more general in its response, but it's also much quicker. And so many immunologists would say that the innate system, it takes care of probably 95% of the disease challenges that you might encounter in your life. It's just most of you don't even notice you've had any kind of issue. So macrophages, coming back to that, are one of the sentinel cells in the innate immune system. And when they sense, in this case, a bacteria present in the tissue, they do try to engulf it and kill it. But at the same time, they're also going to send out a message to their partners in the immune system to try to get them woken up, so to speak, and brought to bear on this fight. So they use a signal called cytokines, okay, that are released and have effect on any local neighboring cells. But also important, those cytokines can reach the bloodstream and send signals systemically. I'll come back to that in a minute. But one of the effects that has, and one of the important role plays, is to recruit this other key innate immune cell, the neutrophil, to this site of infection. So there are lots of neutrophils swimming through the bloodstream all the time. They're born in bone marrow. They're released, kind of traveling around looking for problems. And these cytokines tell them to slow down, to squeeze through the endothelial layer of the blood vessel and migrate into the tube where they can actually engulf and kill bacteria. Another component of that, what helps to bring more neutrophils to the site, is that there are other cells, such as mast cells, that are doing something similar to what macrophages are doing. In their case, nitric oxide, which causes vasodilation. In other words, the blood vessel gets larger, which, of course, is a very simple way to drive more blood flow to the tissue. So hence the swelling that occurs with inflammation. Okay. So coming back to these cytokines that drive these responses, another aspect of the innate immune system is that when cytokines reach a neutrophil or when they reach another macrophage or other cell types, those cells don't just spawn by trying to come in and combat the infection. They also respond by relaying the message. So it's like a little game of phone, except every cell that sends a message tends to get heard by 4 or 5 or 6 cells. And so we can have a really rapid amplification of the message that's going out. And when this reaches a certain scale, a threshold, we get what's called a cytokine storm. And this term is used to describe the really massive increase in blood-borne concentrations of these pro-inflammatory cytokines during an infectious challenge. So these can increase by sometimes 1 to 10,000 fold compared to baseline levels. So if you're used to thinking of hormones that we think about regulating growth or metabolism, things like that, the magnitude of the changes here are just really enormous. And importantly, what we've really got our arms around in the 20 years in this area of research is the idea that these cytokines are not only signaling to other parts of the immune system. And in fact, we've learned that most tissue in the body have receptors to sense cytokines. So the brain sees the signs that are released and changes what it does. Muscle changes what it's in response to these adipose tissue, the gut, and the liver. Okay, and so here's an example of a tissue responding to this, essentially this immune response, but it's changing a part of the body that's not really considered part of the immune system per se. And what happens in the liver is really a well-described signature response called typically the acute phase response. So when high concentrations of inflammatory cytokines reach the liver, it somewhat decreases its normal function, such as making lots of albumin for the bloodstream, and turns on production of proteins that are typically very difficult to detect bloodstream. So these are often called positive acute phase reactants because they increase really dramatically, kind of like cytokines, when the liver is inflamed. So fibrinogen is an example, serum amyloid A, C-reactive protein, haptoglobin. And some of these, I hope this isn't the case, but some people in the audience may have had these analyzed when they've been to the doctor and had concerns about heart disease because these are relatively non-specific markers of inflammatory processes going on. But what they are nice for is, in a relatively non-invasive way, we can use blood samples to assess whether the liver is experiencing an inflammatory signal or not. So I'll especially point to haptoglobin because I'm going to show data from cows that relies heavily on that acute phase protein as a biomarker of liver inflammation. Okay, so back to this idea of two different types of inflammation. The second type of inflammation really was described in the process of trying to understand the metabolic diseases that accompany human obesity. And the reason this is called inflammation, though it's not the same as an infectious inflammation, is that the same inflammatory agents that are elevated by 1 to 10,000 fold if you have a bad infection are also elevated in chronic obesity. The difference is, instead of 1,000-fold increases, we're talking about maybe 2 to 10-fold increases, much more subtle, much more mild, and as a result, we don't really see the outward signs of inflammation that we see with an acute event. We don't typically see fever. We don't necessarily see pain from any certain location. But what does happen is those mild changes in inflammatory mediators alter signaling events in many tissues of the body. Because remember, it's not just neutrophils and macrophages and lymphocytes that respond to cytokines. It's also liver and muscle and adipose tissue in the brain. And so there are long-term effects of these mild elevations of inflammatory signals. Okay. So about a decade ago, people started asking, dairy scientists that were keeping an eye on the human biomedical literature, started asking questions about whether some of these mediators of obesity-driven metabolic disease might also be involved in metabolic disease in dairy cows. And Giuseppe Bertoni's group in Italy was really a leader in this area, and they published a paper in 2008 where they followed cows on commercial Italian dairies and just observed. It was an observational study. They took blood samples repeatedly before calving for about 3 weeks and then after calving again for several weeks, and then submitted those samples, whole panel of analyses. I think there was 11 biomarkers. And to simplify things, I'm just reporting it here as degree of inflammation. Okay, so they term it a little bit differently, but most of these are related to the acute phase response. And so cows with a very low degree of inflammation by these blood panel are in this quartile. They just group them based on the concentrations of these biomarkers. So quartile of low degree of inflammation, intermediate low, intermediate high, and then a high degree of inflammation based on these biomarkers. And then they followed and monitored which of these cows had any kind of transition disorders. And as you can see here pretty clearly, the cows with the lowest degree of inflammation, only about 5% experienced any kind of transition disorder, which is a very good outcome, really, for any dairy. But if you look at the cows in the two highest quartiles, it's more like 45% of cows had some kind of transition disorder, which is pretty rough. So there's at least an association here between cows having signs of inflammation and experiencing these metabolic and infectious disorders. Lots of studies have been done since then, some of them quite large on commercial dairies for the most part. And if I kind of summarize a number of studies, cows with abnormally elevated concentrations of this acute phase protein, haptoglobin, that biomarker is linked to low neutrophils in circulation, okay, which is, again, ties in with poor immune function and higher risk of getting an infection in the mammary gland or uterus or respiratory tract. And then, not surprisingly, probably from that first outcome, this predicts a 4-fold increase risk of metritis compared to the same herd from cows that don't have that elevated haptoglobin. A 40% decreased risk of conception in the first 150 days in milk, which again likely would tie in with poor uterine health. And at least in one study, they reported about a 2,000-pound decrease in whole action milk yield compared to herd mates. So at least the associations here look pretty ugly in terms of all the major outcomes that we're worried about in the lactation. And as probably most of the audience is fully aware, there are very long-term negative consequences of some of these disorders as well. And so it may be that those long-term effects of haptoglobin are mediated through disease risk. We're not really sure. But just to summarize, again, a few large epidemiological studies. These studies suggest that cows with mastitis and early lactation not only lose milk during the window of infection, but if you add up where they should have been for the whole lactation and what they actually produced, the estimate is they lost about 1,100 pounds of milk, whereas cows with metritis or ketosis in early lactation likely lost 700 to 800 pounds of milk. But even more consequential, economically probably, is their risk of those leaving the herd early. Anywhere from 1.5 to 3.5 times greater risk of leaving the herd before having the next calf. So that's obviously, early culling, it's not voluntary, a very expensive proposition. This is data from Oregon State, where they monitored cows on a commercial dairy, and they sampled blood from over 200 cows, and then they split those cows out into whether they were healthy through the transition period, shown here in this group, or those that had mild, severe disease, or ones that didn't even make it to peak lactation. They were sold or died. And really, two big points I want to make here. One is that even the healthiest cows are showing about a 10-fold increase in this acute phase protein that's a biomarker of systemic inflammation. And we've seen this in many, many studies from many different research groups in many countries. There's really strong evidence saying that essentially all transition cows are showing elevations in these acute phase proteins. Okay, we'll get back to maybe what that means later. But the second big point is, although that's true, the magnitude of that response varies dramatically across cows. And here they're showing groups of cows, but the ones that had the biggest disease challenges have about another 3 or 4-fold increase in the acute phase proteins compared to the healthy group. And perhaps more importantly, they took about 2 or 3 times as long to return to baseline. So they're showing signs of chronic or subacute inflammation for 2 to 3 weeks instead of 5 to 7 days in the healthiest group. So there's a number of questions that bring up, and I want to start with what might cause that. And then we'll get into what implications there are that's occurring regardless of what causes it. So I think the easy place to start there is, again, going back to the common infections that we deal with in transition cows. And in this case, I'll just use mastitis as an example. So this is the data where mastitis was induced, so it's not natural mastitis. But I'm showing this because it makes the point that mastitis, even though it's a local infection of the mammary gland, causes systemic inflammation that affects all the organs of the body. So here they put E. coli up the T canal into 1/4 the mammary gland, and you see, compared to what I think the baseline probably was, by 12 hours after that administration, there's about a 1,000-fold increase in plasma TNF-alpha. Again, this is plasma reaching the whole body, affecting the brain, affecting the liver, etc. Okay, so pretty clearly, I could show you similar data for metritis. Pretty clearly, these local infections can cause systemic inflammation. Okay, so we'll start off with that as the basis of our model here. That's mediated not only by cytokines, which I've talked about, but also by lipid signals called eicosanoids, and prostaglandins would be a familiar member of that family. I also want to make one point here. Uterine involution is clearly involved in this mix, although we don't know exactly how. One question that we would like to try to answer is, does the degree of inflammation that we witness in the healthiest cows, is that necessary to make sure that uterine involution progresses as it should so that that cow can be fertile again not long after start of lactation? So we'll come back to some related ideas on that in a minute. Another topic that's drawn a lot of attention in the last decade or so is this idea that oxidative stress, or an imbalance in antioxidants and pro-oxidants, leading to the accumulation of reactive oxygen species, that can actually drive the same inflammatory responses, particularly in the liver, as cytokines can. So there's a convergence of the molecular signals from oxidative stress and inflammation, such that in some respects they're somewhat indistinguishable in terms of the cellular responses. So that can certainly be contributing in some cows. And those two things probably feed into a potential of actually having immune cell infiltration in the liver. Now, this is the data from Jim Drakely's group at Illinois, where they were actually able to show immune cells lodged in liver tissue. And you can see, if you know anything about what the liver should look like, this would look more like normal liver tissue over here. But in a good chunk of this cross-section, there's very, very large lipid droplets signaling very severe fatty liver. And so I think they've clearly shown that, at least in limited cases, we can actually get recruitment of immune cells to this organ, which is not normal, which is certainly going to contribute to that tissue being inflamed. But I think the question remains, is cows that don't have such severe fatty liver, is this very common? And I would guess it's probably not, but that could be involved. Another question that's out there and getting a lot of attention now is this idea that transition cows, maybe because they're changing diets, maybe because they're going off feed for a few days, and what have you, have this what's called leaky gut. So one very important role of the gastrointestinal tract is to provide a barrier against free movement of things from the gut into the body proper. So we don't really want everything to go willy-nilly from the middle of the gut into the bloodstream, so to speak. In a leaky gut scenario, there's some loss of that barrier function, and bacterial toxins such as lipopolysaccharide can, in those cases, move fairly freely into the bloodstream. And from the gut, all the blood flows first to the liver and then on to the rest of the body. So it's potentially the case that the liver is seeing a really elevated dose of this, what's called endotoxin, during this window. I'm getting increasingly speculative here, but there is also evidence that heat stress, which drives production of protein called heat shock proteins, in which they become elevated in the bloodstream during severe heat stress. Those can also trigger inflammatory responses in tissues that sense those heat shock proteins, including the liver. So that may evolve, although that hasn't been properly tested in cattle. And finally, my most speculative component is this idea that handling stress may actually contribute, or social stress, if you will. This is data from a study with steers, where steers were simply taken out of their pen that they'd been in, put on a truck, driven around the north part of the U.S., listened to country music for 4 to 6 hours, and then stuck back in the pen they started from. And just simply that little bit of stress and that short window of time without water and feed was enough to drive a significant increase in this acute phase protein when it was measured 2 days later. And haptoglobin does take a while to respond and does have a long half-life, so it's not terribly surprising that it would a 2-day delay in that response. So based on that and based on some mouse literature, we suggest that it's at least possible that stress hormones responding to social or handling stress could actually contribute to this phenomenon as well. So I guess the overall point is, what drives systemic inflammation in transition cows? Well, we don't really know. It's probably a mix of things, and my guess would be that it differs from cow to cow, and that's probably why we see such variation in the magnitude of the response. Okay, so I'm just curious to see, those of you who work with commercial dairy farms, which factors that I've laid out do you suspect might be most directly associated with early lactation inflammation in the herds that you work with?
Well, here we go. Let's look at those 4 choices here, Steve.
Mike.
And the first one is mastitis. The second one is metabolic disorder. The third one, metritis, endometritis. And the fourth one, environmental stress. So, Steve, you've had a chance now to ruminate on this. What are you going to do?
I think I'm going to go with metritis and endometritis for no real good reason. Gut feeling. Let's call it
gut feeling ties right in the. I'm going to go with metabolic disorders. I'm not quite sure.
Okay.
I'll take.
And they're voting good.
I'll take that. I'll take that shot. But we're up to 2/3 voting. Now I guess we finally got the people done. So Jim has shared it. What do you think? What we have here, Barry?
Yeah, I'd like about close to a 50-50 mix of infectious and metabolic, and I suspect what it is all the nutritionists are pointing the finger at infectious disorders, and the vets are pointing at the metabolic disorders, and we have to blame the other guys, right? No, just teasing. I think in my experience, the farms that I've worked with, there does seem to be a variation between herds and what their biggest challenges are, and I suspect that's also the case when we look at inflammation. Interesting to see that about 15% said environmental stressors, and in this we deal with a fair bit of heat stress, and I suspect that at least some of our herds in the summer that would be potentially one of the big drivers, although we still have to learn about that. Thanks, so interesting response. Okay, so really one of the biggest questions that my group has tried to tackle in the last decade is this question of what's cause and what's effect. So showed you lots of data from what I called epidemiological studies, basically observational studies where samples are taken on lots of cows and they're associated with disease outcomes or production outcomes and what have you. So the only problem with those kinds of studies is they can't really tell you what's cause and what's effect because, for example, the Italian study I showed you, it's entirely possible that cows with inflammation were more susceptible to disease, but it's every bit as possible that all that was being shown in those studies was that inflammation's elevated when cows get sick, which is kind of like duh, right? So we wanted to try to directly cause inflammation and see if that actually drove cows towards a disease state. Whether they got clinical disease or not was not necessarily the goal, but more, are we shifting things in the wrong direction? So just to summarize a study we published a few years ago, we had 33 Holstein cows put on one of 3 treatments, And we had recombinant bovine TNF-alpha, this inflammatory cytokine, produced, and we administered either control or this TNF-alpha at 1.5 microgram per kilogram body weight, or double dose 3 micrograms per kilogram of body weight. And before I dive into what we found, I want to preface this with saying we were specifically looking to mimic this subacute inflammation that I tied into the obesity research area before, because that's what we see in the majority of cows in early lactation. We don't see really overt acute inflammatory signs, systemically anyway. And so we were trying to mimic that, and we were successful in that I'll show you that we saw some responses to inflammation, but what we did is an increase in body temperature. We didn't see any overt sickness behavior beyond what a normal transition cow shows in terms of maybe poor appetite at times. Okay, so and then we gave this subcutaneously once a day for 7 days. So that's another way that we tried to make this a subacute model rather than giving it IV where all the cytokine is hitting the body all at once. Giving it subcutaneously, it's hitting a small number of immune cells at a time, and it slowly has to build a response to that. Okay, so I'm just going to show two of the most relevant outcomes in this study. First of all, dry matter intake, which I think is kind of the linchpin to a healthy transition cow program. And if we grouped the two TNF-alpha groups here, we saw a significant 18% increase in dry matter intake. Okay, so by day 3, we saw a pretty marked response for both groups, and average over that time 18% drop. This isn't significant because it's a small study, but still I think it's worthwhile pointing out if we use a threshold of 1.4 millimolar for blood BHBA as a sign of subclinical ketosis, we only saw 9% of the control group hitting that threshold, but 27% of the two TNF-alpha treated groups. So, and it makes sense. If cows are eating less feed, they're more likely to suffer from metabolic disorders. And likewise, we saw a 15% decrease in milk yield. So that kind of matches with the feed intake response, and again ties in with the idea that perhaps these very mild levels of inflammatory responses are problematic for cows in terms of adequate feed intake and hitting peak milk yield quickly. So this is kind of the model that we're working under now for trying to explain this complex mixture of metabolic and infectious disorders in transition cows. So the number one risk factor I always tell people, if you want to predict cows that are going to have problems, is excessive body condition score. So we think that contributes to metabolic problems and to infectious or immunity challenges, if you will, because these fatty acids, the non-esterified fatty acids reaching the liver, alter metabolism, and they also, of course, provide substrate or the building blocks for making ketone bodies like GPA. There's evidence then, although it's not always consistent, but there is some evidence that ketone bodies can directly inhibit the function of key immune cells such as lymphocytes and neutrophils. And if that's the case, then a cow with ketone bodies suppressing the function of those immune cells is more likely to allow pathogens to actually get a fold and grow into a true infection. If that becomes the case, then there's a much more dramatic immune response, which requires much greater elevations in cytokines systemically, and then that's going to circle back and alter liver function, as we've already talked about. And we do have evidence from other studies that one of those responses is to promote ketone body production. And so there we have this cycle being produced that's kind of the hallmark of pathology, where you get a spiraling out of control, loss of homeostasis, and then the cow is going to have trouble recovering. Obviously, that's a worst-case scenario. Nowhere close to all of our cows are going to see that extreme version of things, but at least this is a model that seems to fit with a lot of the data that's out there. Okay, so we'll move on from there, but first I want to ask you, based on that partial story, at this point, how would you characterize inflammation around calving, or based on your experience as well as that information?
Wow, this gets pretty exciting here, Steve.
Yes, it does.
I got mine picked out already. The first one says it's a normal process. Don't worry about it. Number 2, it's a signal or sign that we have a health challenge. We need to treat it. Number 3, we should treat the inflammation if it improves the outcome. And number 4, drugs are not needed in this scenario, and just save that. So we're off and running on the voting here, Steve. Where are you gonna vote?
Well, I think we can't ignore it, so we don't want to go with the first one. I think number 3 there. Let's treat it if it improves outcomes. I'm a little bit at a loss.
Yeah, that's where I would vote as well, and we're at 2/3 of the vote, so let's close the polls. Jim, let's share the polls, and Barry, any big surprises here for you? Steve, obviously we weren't very popular.
No, we weren't.
Oh, it's interesting. I haven't really asked that question of an industry audience before, and I'm not sure what kind of response we get. I would definitely fall somewhere in between 2 and 3. I tend to be pragmatic, and part of that comes from I spend a lot of time around egghead academics, and most of you know we can talk ourselves into any kind of point that we think we can try to make. So often it seems like we can get wrapped up in something that when it's actually tested in the real world, it doesn't really show that it's that important. So I'm a big believer in actually evaluating whether it improves things. So that leads in nicely to some recent data that's come out that kind of gets at that question. So we've been asking in a few studies in my group, and some others have as well, whether it's logical to block inflammation. So if adding more inflammation makes things worse, if high levels of inflammation are linked to poor outcomes, it just kind of follows that maybe it's logical to try to block it. But I have to start off with a warning message. So this work was not started in my group. Others had been asking this question before we really got onto it. And one of those groups is the group up at Guelph. Tuffield and colleagues had designed a really powerful study with flunux and meglumine, and did this in the late 2000s, and had over 1,300 cows enrolled. So lots of power, very well designed. And what they found out, unfortunately, was that when flunexin was given twice in 24 hours postpartum, the risk of retained placenta in those treated cows compared to placebo went up by 2.5-fold. And probably linked to that, a 1.5-fold increase in metritis, highly significant responses. And they even had more significant problems when, in an earlier iteration of this study, they gave flunexin before calving. And so clearly it's a problem. Why is it a problem? Well, it's probably because this is a potent, flunexin is a potent cyclooxygenase 1, COX-1 inhibitor. So the basic fundamental prostaglandin production is requiring COX-1. It's basically being blocked by flunexin at some level, and probably that interruption of normal prostaglandin production just disrupts the normal process of giving birth, delivering the placenta, etc. And so clearly, if we're too good at blocking too much inflammation right around this window, we can cause problems. So thankfully, that work was done before my group got too involved in it, and so we were able to learn from that. Since then, there's been studies kind of highlighting that perhaps different drugs with different specificities of activity maybe won't all have that same challenge. But nevertheless, when we started down this road, we administered our drug starting 24 hours postpartum after basically placentas were delivered, and that wasn't an issue. We tested 2 different drugs, sodium salicylate, which is the parent compound of aspirin, and meloxicam, which is a more modern drug. It's a designed COX-2 inhibitor as opposed to a COX-1 inhibitor as flunexin is. We did this on a commercial farm, and we were able to enroll 51 cows per treatment. We only used multiparous cows in this study. And again, just to boil it down for simplicity, I'll go to the 2 or 3 most relevant outcomes. So because of previous studies where we'd seen some exciting hints at this, our main outcome of interest here was milk yield. And we gave salicylate in just 3 doses, 24, 48, and 72 hours after calving. And we saw an 11% increase in whole lactation milk yield. So again, the cows on salicylate were treated no differently than all the other cows after day 3 of lactation, and yet 302 days later, they were making significantly more milk. Likewise with meloxicam, because it has a longer half-life, we only had to give a single dose of this drug, and we saw a 12% whole lactation milk yield increase. So ballpark of 2,000 pounds of milk in response to both of those anti-inflammatory treatments. Okay, I have to point out here that unfortunately these strategies are not approved for commercial use. There's no FDA approval for these uses or for any other kind of blanket treatment at this time. But we investigated this, again, trying to understand what are the long-term implications of inflammation in this window of time. And by trying to block it, we can hopefully, and it seems like we did, uncover some really potent whole lactation impacts. One natural question that some people ask then is, did you milk those cows sick? Did you make them too thin? Did they fail to breed? That sort of question. And our other key metric that we were watching in this study was their risk of culling. So this is a plot, survival curve in the herd. So not just survival in terms of alive or dead. This is survival meaning they were not culled, or so both culling and death are involved in this. Okay. And I also want to point out again a reminder: this is only multiparous cows. So they left at a faster rate than they would have if we had had primiparous cows in the study, because they tend to be culled at a lower rate. Okay, so that being said, the control group is in the black line here, and you can see by 1 year after the initial treatment, the initial calving, about 40% of the control cows at the herd. If we look at the salicylate group with the blue dots, they left at a similar rate for the first 100 days in milk. And after that, they seem to level off, but there's no statistical difference here. However, the meloxicam group in red, they seem to deviate pretty quickly in early lactation in terms of staying in the herd better. And the overall curve was marginally different at a p-value of 0.06, meaning there's a 6% chance that was just by flipping a coin that difference, but more than likely there's a difference there. So that was very much exciting to us, in that not only were we seeing increased milk yield, but some hints at perhaps better health, or at least better retention in the herd at the same time. For reproductive outcomes, again, we looked at survival curve analysis of time to pregnancy, and we saw really no hints whatsoever of any difference here. Okay, so any health benefits that might have been the case in meloxicam did not result in quicker return to pregnancy. However, it's also true that giving more milk didn't delay their return to pregnancy. Okay, so based on all this collection research, we published a review article last year where we laid out some hypotheses, and this is one that I hope drives some research in the coming years. Our idea is that perhaps it's not the big spike in inflammatory mediators at the beginning of lactation that's a problem. Maybe this spike for a day or two is necessary to get the uterus moving in the right direction. We even have some hints that may be involved in helping the cow adapt metabolically to conserve glucose and avoid hypoglycemia. However, in those cows that have a delayed resolution of that, where the inflammatory markers stay elevated for a longer period of time, maybe that's what's tied to, say, poor feed intake, negative balance, metabolic disease, and infertility. Okay, so we don't have, again, blood evidence for this, but I hope there will be more data in the coming years to evaluate this idea. Okay, so we got one question ahead of this webinar from some Canada. Michael asked, he said they already feed second cut grass hay as the primary forage source to all their dry cows, and asking what's the highest level of potassium that can be fed in the forage to keep the inflammation down. and they're at a current potassium level of 1.7% of the diet, I assume is what they're saying, or percent of the grass hay anyway. So my typical target that I would like to hit in early or dry cow diets would be somewhere around 1.5% potassium, but a forage at 1.7 shouldn't be a real problem. I don't see any direct link between potassium in the diet and inflammation. However, this is a strong cation that's going to drive DCAD concentrations up, and so limiting potassium is really important for the anionic diet strategy that we typically use to try to maintain blood calcium in cows right after calving. And is hypocalcemia directly involved in inflammatory responses? Well, we don't really know, but they do seem to be interlinked, at least associated. And again, cause and effect becomes a problem here. But I do want to quickly point out, as time is slipping away here, that even if potassium is maybe not the #1 nutrient for involvement in inflammation, there are many, many ways that nutrition can influence inflammation through all 4 of these aspects and probably others. And I want to highlight just one really interesting study that came out a year ago from Germany, where they evaluated a feed additive that was actually made from tea leaves and curcumin, and where they fed that supplement for the last 3 weeks prepartum and for the first 9 weeks of lactation. And again, pulling out 2 really interesting outcomes. First of all, non-esterified fatty acids, plasma NEFA, after calving was cut basically in half by this polyphenol source. Okay, so we don't really have good evidence pointing to exactly why that occurred, but that's a pretty exciting result. And then, like the drug studies we've done, when cows were reaching peak lactation, those cows that got the polyphenol supplement showed about a 10% increase in energy-corrected milk, and that's maintained throughout peak lactation. So I think there is some real potential to use bioactive nutrients found in plants in crude extracts that can maybe improve the inflammatory status of the cow in some manner, and maybe improve the function throughout early lactation without having to turn to pharmaceutical products. Okay, so my take-home points are, hopefully I've convinced you that inflammation is common in early lactation, and I think it's likely stimulated by multiple pathways that probably differ by cow. My last home point is that we do have some pretty exciting evidence that targeted use of anti-inflammatory agents might improve the transition to lactation, both from a health and a productivity standpoint. And I'm excited about the potential to be able to use dietary tools to accomplish those same goals down the road, and we're certainly working on that, as other groups are as well. And that's half, so hopefully we'll have no more disruptions and we can try to answer some questions.
Okay, again, thank you very much, Barry, for I think sort of an introduction for a lot of us, part of our fresh cow management, transition cow management that maybe we haven't thought as much about in the past as we should have. And it sounds like could be some very interesting things coming out of this work that you're doing and others as well. Those are some pretty nice responses on milk. So we'll stay tuned, see how this plays out in the points. Nice job. Pointing out also, those of you listening out there that were with us today, you're going to be receiving a survey here in a couple of days. We appreciate your feedback on that. And also, if any of your colleagues, friends, coworkers wonder how come they didn't receive notice about this webinar, tell them to go to hordes.com and click on the webinar section of our homepage, and they can re-sign up, which is something that all of the participants needed to do. We congratulate you that already did that, because you're with us, and we appreciate that. Also, going forward, folks will have an opportunity to ask questions before the webinars begin. So about a week before the webinar, there'll be an announcement of the forthcoming webinar, and an opportunity for people to ask a question, raise an issue that they would like to discuss, and we will try to address it with the presenters if at all possible. And we hope that you'll be with us in another month December 12th, John Gosser from Rock River Labs, right up the road here at Watertown, Wisconsin, will be talking about how this year's forage will feed. There's lots of it out there. John will tell us about the quality of it. And then looking a bit further ahead, another Kansas Stater, Jeff Stevenson, will be with us, giving us an update on reproduction. And the December webinar will be sponsored by QLF, and as you can see, Parnell will be sponsoring the January webinar. And with that, Mike, are there some questions that might have? One that I have for you, Barry, is on the aspirin and the, I think it's Melox. What was the route of administration? Now again, we realize that those are not approved treatments at this point, but how were those treatments administered?
Both of those were oral boluses, and meloxicam is approved in some places of the world for an adjunct to mast treatment, but typically it's injection. So there are some differences from what we've done and what's typically done.
Okay, thank you. Mike?
Yeah, we have couple of interesting questions here. Well, Barry, any idea what's the nutrient cost of inflammation? In other words, my cow has inflammation. Nutritionally speaking, what is that costing the cow and or the dairy farmer who's trying to meet her nutrient needs?
It's a great question, and it's one I've debated at length with some of my colleagues, and it's a difficult one to answer. I think from a pure energy standpoint, I've yet to be convinced otherwise that in a dairy cow, because of her crazy high energy utilization, the magnitude of the total energy expenditure for an inflammatory response, I estimate is about 7 or 8% on top of her normal energy costs, or probably subtracted from energy towards milk. So I don't think, basically in a resting human who has a low energy requirement, it's about a 25% bump is what's been measured. And so I don't think that's the real story. I think there's two big stories. One is just the drop in feed intake, so there's just less energy supply on top of the higher energetic cost. But also we have to think about not just energy, which isn't really a true thing, it's a concept. We have to think about the actual energy substrate. And so Lance Baumgart's done some nice work in the last couple of years showing that there's a big drain of glucose specifically during an inflammatory event, probably because immune cells preferentially utilize glucose. And so even if energy drain isn't a huge deal, the glucose drain specifically may well be.
Okay, we have another one, and just wanted to know, what does polyphenol exactly do?
So polyphenols are a very broad class of nutrients. There are probably thousands of them that you can find in plants in nature, and so kind of painting them with a hugely broad brush is probably a mistake. However, many of them have clearly been shown to have both antioxidant and anti-inflammatory properties, and in fact some of those polyphenols have both of those at the same time. And so tying down an exact mode of action for specific polyphenol is a challenge, but they do seem to shift tissues in the direction of less inflammation, less oxidative stress.
This may not be a fair question, but we'll ask it anyway, and that is, what dietary things might you consider or tell a dairy farmer who heard this presentation and said, wow, what can I do nutritionally to help this cow out? Do you have any guidelines?
So I think it's definitely true that even some inflammation is required in normal, that we don't want to really add to the flame, right? So whatever we can do nutritionally to maintain normal gut function and prevent any kind of leaky gut thing is going to be good. So we certainly want to have adequate fiber and make sure that we're maintaining gut that way. There's some decent evidence recently that amino acids can promote immune function and perhaps prevent a true infection from taking hold, and thereby preventing inflammation associated with infection. And there are some nutrients that have very clear anti-inflammatory effects, and so omega-3 fatty acids certainly stand out in that respect. There's a laundry list of potential things here. We haven't really played a lot with minerals in ruminants that they have in monogastrics, and there may be some things we can dig into there as well.
We have another question. Have you looked at the possible association between early lactation inflammation and future lameness, specifically, claw horn disruption and development?
Well, there are some good research groups around the world, a couple I could think of in Europe, that are kind of asking those types of questions. I specifically have been very involved, and I'm not terribly up to speed, but I know that people are drawing those links, and I think the question comes down to the specifics on tissues of where is the inflammation starting, where is it affecting specific tissues in that hoof. I'm not the best person to answer beyond that, probably.
Here's our last question, and that is the body condition score. It appears your presentation would indicate that be another risk factor to maybe keep cows more on the thin side. Any comments on adipose fat cows or heavy cows?
Right, and there are some differences of opinion out there on that as well, but my take is I've really not seen any evidence that you're better off having heavier cows from a disease and early lactation standpoint. So from a pure disease avoidant endpoint, and I know some people actually say this, you should maybe target body condition score 3 or even a little bit lower. But the trade-off there is if you look at reproduction as an important outcome as well, and there's evidence that that's probably too low for proper fertility. So I usually say 3.5 is a good target, but it's really more about the variance than the mean. So keeping cows near 3.5 instead of averaging 3.5 because you have some 4.5 and some 2.5 is really the key.
Well, Dr. Bradford, thank you very much. Steve, I think we've got all our questions answered here. We'll turn it back to you to wrap up.
Very good, and we just almost within our time limit, so that was all very well done, Mike. And again, thank you very much, Barry Bradford, for a very interesting and enlightening presentation. Again, our thanks to Virtus Nutrition for their support of today. Again, an invitation to be with us again in a month from now, talking about feed quality this year, how it's going to feed, QLF, feed sponsors. Looking ahead, Kansas State, Jeff Stevenson, reproduction update, always a good topic for us, and Parnell will be bringing that. So, and we again thank those of you that were with us today. A lot of you on board and stayed right with us all the way through the question, which is a good sign that you were interested in the topic, and we appreciate that interest and that participation. And with those comments, this is Steve Larson from Hordes Dairyman signing off for this webinar day up here in Wisconsin. So hope to have you back with us again.